Well, if you ever had to make a quick decision about where to go for fast medical treatment or an injury, you're going to want to hear this.
Because going to the wrong medical facility could mean thousands of dollars more in unnecessary costs. The Dallas Morning News watchdog, Dave Lieber, has figured out how we can all avoid sticker shock on some medical bills. Dave, thanks for joining us today. This is something I've always wondered about.
Well, you know, it's scary because since 2010, these freestanding emergency room clinics have opened up in shopping centers, mostly in the affluent suburban areas. And people don't realize that they are real emergency rooms. They are not, your standard doctor urgent care type of place.
So
and
explain the difference. Explain the difference between these different places.
Well, the urgent care, like a Care Now chain, those are just regular, simple medical services. You have a flu on a weekend or something. But these ERs, these emergency rooms, these 24/7 places that are on the street corners now, they charge emergency room prices for some very simple procedures that people bring them in emergency situations.
So what if someone is having an actual emergency, like a severely broken bone or a deep cut, something like that?
Well, you have to make a quick decision. You have to decide whether you want to go to a real hospital emergency room or you want to go to one of these corner emergency rooms. I would suggest that you check into whether these corner emergency rooms are actually in your insurance network before you have a family emergency. That would probably be a smart way to handle it, because you go into these places and you ask, do they cover my insurance? And they usually say, yeah, probably, but then you get a bill for $10,000. I got a guy who took his daughter to one of these places and there was a $10,000 bill for a dislocated elbow. That's just insane. But these doctors in there, they're real ER doctors, and they're also nurses. And the Care Now places, the urgent care, they usually have nurse practitioners or physician assistants. So there's a big difference in the quality of the care, but sometimes you don't need to go to those really expensive emergency rooms just to get a dislocated elbow or flu or a virus or a cut. It all depends.
And would sometimes going to the hospital actually be cheaper?
Yes, sometimes going to the hospital would be cheaper, but going to your family practitioner or going to the urgent care place like a Care Now is definitely going to be the cheapest, especially if it's in your insurance network. But I just want to remind Christy, that you need to know if there's emergency in the title or ER or 24/7. Those places are going to be higher fees. You also need to know that these places must by law advertise as emergency centers. They can't hide that. And you need to ask them if they're in network, and don't always take their answer on gospel. Check yourself to find out if it's part of your insurance plan before you actually go in there and run up the big bill.
Dave Lieber with the Dallas Morning News. This is why we talk to you every Monday, because you always bring it with good information. We certainly appreciate you. Thank you.
Thank you.